Watch our patient see her brand new teeth for the first time.
And I'd wait a million more for you.
Stop.
Nothing prepared me for what the privilege of being yours would do.
Oh my God, I never thought I'd have teeth.
Hello, I'm Dr. Mahnaz Rashdi. I'm a periodontist in Beverly Hills, California. Today I'm going to discuss Rosa's case with you, and as you see, her dental treatment was actually a life changer for her. So Rosa is a single mother raising her children and working very hard. All these years, basically what she has done was taking care of her children and did not care about herself as much. Although she has seen dentists, you can see she has so many crowns, and but unfortunately it was not done properly. And every time she went to a dentist, the treatment was basically just a repair, and repair after repair and after repair, until it got to a point that now her bite is completely off, her face is completely deformed, and if I can show you on her jaw, you can see how much of bone loss she had, and you can also notice here how her lower jaw, because of excessive grinding and cutting her teeth to the lower area, the bite was completely collapsed, and she looked completely different than her actual face years ago. So she wanted to see a dentist, but she was petrified too. She was like, you know, I always talk about how dental phobia causes a lot of damages, and I personally call dental phobia a silent killer as well. We get a lot of people with severe infections that they have never been treated because of their fear or dental phobia. We see a lot of people who have cases like her that the bite was completely destroyed because she was so afraid of going to dentist, and also shame. She was also very ashamed of going to somebody and talking to someone about the case. So we spoke about the case, and we did go through a very important first step, which was treatment planning, making sure that she was educated about what she was going to go through, and also having a blueprint. This is my belief in my office. You need to have a blueprint and then build from the bottom all the way up. So the process of full mouth reconstruction for Rosa took about 6 months. From the very beginning, we started to make sure that we got rid of the infections that she had, and if she needed any gum surgery, we take care of it. We also did multiple implants for her. And obviously, you know, once you place an implant, there is a process of healing. During this healing process, we took care of other teeth that they were okay and ready to be crowned. So we crowned some of them. Because her bite was completely collapsed, I had to give her a period of the time that she was in temporary with a more built to her bite and increasing her vertical dimension of occlusion, and let her get used to that idea, because once your bite is collapsed, these muscles start to shrink, and now to open it back up to where it was, these muscles, they feel the tension. So the patient needs to be on a period of time that they are basically wearing prostheses to train this muscle. We also obviously use some Botox injection for this muscle to relax. And she was an excellent patient as far as like communication and being compliant as at home. You can see now when she was smiling before the treatment, see how much of space is between the upper and lower teeth. This by itself, it was a proof how much of collapsed bite she had. And you can see now here how when she smiles, she has the very minimum space in between. The teeth are back to where it's supposed to be because her bite was collapsed, the lower jaw was completely going under the upper. She ended up having a severe, large amount of overjet, and now we got rid of all of this. This is her beautiful smile, and you saw how emotional she was when she was receiving the treatment and she saw the final restorations.
Hi, my name is Rosa, and for years I've had a crooked mouth, I've had partials, I've had broken teeth, and I've always wanted to smile, and it kept me from smiling for most of my life. I had this problem. I was advised by one of my colleagues or one of my coworkers who told me, go see this lady, that she could help me. And I went to see Dr. Rashti. She was a godsend to me. I told her what I wanted, and immediately she told me what I should do and how she's going to help me. She proceeded to do everything that she had originally stated that she was going to do to help me. And after months and after time, I finally have a smile. So to those of you out there who want a smile and who just want someone to listen to your problems and who can help, please go see Dr. Rashti. And her staff is awesome also.
So I have several people asking questions, and I want to answer to some of your questions regarding this case. The very first question that it was very common and a lot of people wanted to know about, what's the difference between the implant and dentures? Well, Rosa was wearing a denture during this process as well, a partial denture too. Because if you remember, she was missing multiple teeth and I had to place dental implant and then restore it. Now every time you place a dental implant, if you want to have a good situation, if you want to have a good healing, there's a period of healing that you have to go through. I personally do not believe with immediate loading, and there's a reason behind it, is that when you place the implant, you want to make sure bone gets time to grow and get ankylose or osseointegration of the bone to the implant happens. That requires time. Now, during this period of time, you don't want any type of movement or load on the implant, specifically if it's like one or two implant in any area, so it doesn't have bilateral support. During this period, the patient cannot walk without anything, so it's like a partial denture that she was wearing. Again, as I mentioned, I wanted her to be on a removable prosthesis for a period of time so that we increase her bite and she gets used to the idea of like stretching her muscle again. That denture or those dentures that she or any other patient wears during this process of full mouth reconstruction is removable. It comes out, at night you take it out, after you eat you take it out and wash it and clean it, so it's removable. But dental implant, the implant by itself, it's a titanium screw that goes in your jaw. Bone starts to grow and gets adhered to it. On top of that, you build a abutment and you put the crown. That crown is not removable. You cannot remove it. We can as a dentist with our instrument, but you as a patient cannot remove it. And that's the beauty of it. It becomes a part of your jaw, it becomes a part of your mouth, so you function on them exactly as if you function on your own teeth. So the second question is, a lot of people are concerned about once you have the implant, when you start eating. Well, if the implant is placed surgically, I'm sure that your surgeon will remind you that, the first day you have to be on cold diet and soft diet. I personally recommend all of my patients to be on soft diet for at least a couple of weeks. And then after, then you can start to have like more solid, but still you don't want to bite on nuts or like something so, or biting on bone or anything like that. Once the implant is integrated and you actually restore it, you can start going walking out of the dental office and start to have your biting on your sandwich and enjoy your food. So once the actual implant takes, meaning once bone grows to the implant, then the function of chewing can be done as soon as your crowns is in your mouth. One other question which was very common between a lot of people was, do I get cavities? Do I still need to see my dentist after I have implants? Well, you still need to see your dentist for maintenance. This is the most important part of your treatment. And I tell all my patients, believe me, no dentist is going to make any money by you going for your maintenance. Maintenance phase of your treatment is purely for your assurance that the money that you spend is well spent and is well maintained. So when your dentist asks you to go every 3 months for checkup and cleaning, it's not that they want to make money on you. It's just that to make sure the investment that you have done was well worth it and you enjoy the investment that you have done. You enjoy your health and the health of your mouth as well as health of your implants. So no, implants do not get cavity because they are titanium. They do not get cavity. However, yes, implants also, when you have implant, you may get gum disease, you may get abscesses, you may get infection around them, and that's purely by, not flossing properly, not brushing properly. A good oral hygiene and also a good occlusion should gives you, if you're in good health and you're not smoking, should give you a long-term good prognosis with your implants and also restoration that you have in your mouth. With the maintenance. Like real estate, everything is about location, location, location. For dental work, everything is about maintenance. We do one part in our office, you do 99 parts at your home. You need to make sure you follow the instruction from your dentist, and also you see your dentist every 3 months. Every 3 months, if you go and see your dentist, if anything happens, they can detect early signs and they can treat it without a drastic changes in your mouth.